Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we are focusing on a neurological condition that carries an immense physical and social burden, Tourette syndrome. For those living with Tourette's, navigating involuntary tics while managing the deep internal premonitory urges that precede them can be an incredibly draining daily battle.
It really is a profound challenge, which is why Pennsylvania took formal action to help. As we highlight at PennsylvaniaMarijuanaCards.com, Tourette syndrome was officially added to the state's medical marijuana program in July of 2019. This happened after the Secretary of Health approved a formal recommendation from the Medical Marijuana Advisory Board, establishing a legal, stand-alone pathway for patients to find relief.
It's fantastic that the state formalized that addition. Your guide mentions a really fascinating scientific metaphor for how cannabis works inside the brain for Tourette's, tightening a leaky filter. Can you break down the biology of that mechanism?
It's all about a brain region called the basal ganglia, which regulates movement control and dopamine signaling. In Tourette syndrome, that neural filter becomes leaky, allowing involuntary motor and vocal tics to slip through. Because the basal ganglia is incredibly dense with cannabinoid receptors, introducing THC helps modulate that chaotic signaling. It essentially tightens the leaky filter, helping the brain suppress those involuntary physical and vocal expressions.
That is a perfect visualization, and the clinical data backing this up is exceptionally strong, highlighted by a landmark double-blind randomized controlled trial published recently. What did that study find?
The data published in NEJM Evidence in 2023 is a total game changer. Researchers conducted a rigorous crossover trial using a balanced oral cannabis oil. They found that patient tic scores on the Yale Global Tic Severity Scale dropped substantially compared to a placebo. Even better, patients reported meaningful relief from common co-occurring conditions like anxiety and obsessive-compulsive symptoms.
That is incredibly comprehensive relief. Because as any patient knows, Tourette's rarely travels alone. But your guide notes that navigating the balance between THC and CBD is highly specific for this condition. How should patients approach the two compounds?
This is a crucial distinction. THC is the primary clinical driver for actual tic reduction and motor control. However, using high doses of pure THC can trigger cognitive side effects or spike anxiety. That is why CBD plays an invaluable supporting role. It stabilizes the therapy, tempers the psychoactive profile of THC, and directly targets the underlying anxiety and OCD symptoms.
So a balanced approach is really the scientific sweet spot. How should a patient utilize this information when they visit a Pennsylvania dispensary for the first time?
The golden clinical rule for Tourette's is to start low and titrate very slowly. Patients should consult with the on-site dispensary pharmacist and request a balanced 1-to-1 or 2-to-1 THC to CBD oral tincture or sublingual oil. Tinctures are ideal because they mirror the exact oral formats used in the NEJM Evidence trial and allow for highly precise incremental dose control. You want to avoid high THC products with zero CBD as they can cause unnecessary cognitive clouding.
Perfect guidance. So if an adult living with Tourette syndrome is ready to safely obtain their state medical card through our telehealth clinic, what is the protocol?
We provide a highly streamlined, compassionate, and fully remote pathway. Step 1 is filling out our secure 3-minute pre-qualification form at PennsylvaniaMarijuanaCards.com. Step 2 is your telehealth video evaluation from home. You'll consult directly with a registered state physician, like Dr. Jonathan Chance Miller, whose active clinical credentials and NPI number are openly displayed on our site for absolute medical verification. You'll just need a basic medical record or doctor's letter confirming your diagnosis.
And your practice protects every single applicant with an absolute financial safeguard. If for any reason the doctor reviews their case and decides cannabis isn't the right fit, there is zero risk.
Exactly. If our physicians determine that you don't meet the state's clinical criteria or that cannabis isn't a safe option for your care plan, your $159 evaluation fee is fully and instantly refunded. If you are approved, Step 3 is automatic. We submit your state certification the very same day. We also guide patients on how to request state registry fee waivers if they are enrolled in assistance programs like Medicaid, SNAP, WIC, or CHIP.
Comprehensive neurological insights, clear product safety rules, and an absolutely risk-free medical evaluation standard. An extraordinary resource for the Tourette syndrome community in Pennsylvania. Thank you. If you are ready to explore medically guided, risk-free symptom relief for tics, premonitory urges, or chronic anxiety, visit PennsylvaniaMarijuanaCards.com. Fill out the form at the top of our page and let our dedicated team guide you safely through the program. Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening and take care.